I'm Jeff Allen, the Director of Sports Medicine and the Head Athletic Trainer at the University of Alabama. As an athletic trainer, I understand the effects an injury can have on an athlete, on their career, and also on a team's season. One injury that we deal with, quite often is meniscus injuries of the knee. Today, I have with me two special guests with me today. First, I have True Ray. True is actually hopefully a future Crimson Tide football player here and a big fan of the University of Alabama, and he's joining us today to hang out with us a little bit. I also have with me Dr. Lyle Kane. Dr. Kane is with the Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama. Andrews Sports Medicine is the official sports medicine provider for the University of Alabama. Dr. Kane is a sports medicine orthopedic trained physician and also is the team orthopedic surgeon for all of our athletic teams here at the university. In addition to that, he's an alumnus of the University of Alabama. True, Dr. Kane, great to have y'all with us today to talk about meniscus injuries.
Thank you, Jeff. My name is Lyle Kane. I'm an orthopedic surgeon at Andrews Sports Medicine and Orthopedic Center. And all the physicians at Andrews Sports Medicine are very proud to be part of the University of Alabama tradition and currently the medical staff. I've had the opportunity in my career to treat athletes at many different levels, including not only youth and recreational athletes, but also college and professional athletes. And probably the most common injury we deal with in sports is a meniscus tear. People generally know those as cartilage tears of the knee. And you see athletes all the time that have these injuries, but I think it's very poorly understood by most people in general public. The meniscus is a small little piece of cartilage that acts as an accessory bumper in the knee. It fits right between the bones, between the thigh bone and the shin bone, and it acts to help pad the knee when playing sports or running or jumping or doing any kind of physical activity. The meniscus can be torn in a lot of different ways. In young athletes, it's most commonly a result of a contact sport like football or soccer or someone getting hit in the knee or twisting the knee. But in the older population, people over age 45 or 50, it can happen from very minor trauma, just standing up from a seated position, stepping off a curb, twisting the knee, can tear the meniscus. So meniscus injuries happen in a lot of different ways and are different between different individuals. The symptoms of a meniscus tear most commonly are pain and swelling, oftentimes with certain positions or certain movements. Many people with meniscus tear can do all activities as long as they're in a straight ahead position, but when they try to twist or cut or turn is when they get symptoms. They also have swelling oftentimes. The knee will swell up and get fluid in it, which is a pretty sure sign that something's going on in the knee that needs to be evaluated and treated. The people at risk are two different age groups, the younger athletes, high school, college, and even the professional athletes, and then the older population who may not be as active but are still doing sports and trying to play tennis and golf and other activities that may affect the knee. Treatment for meniscus tear depends on the age of the patient, the sport that they play, and the type of tear that they have. The meniscus itself is a small piece of cartilage that doesn't have very good blood supply. So in many patients, the meniscus tear has to be actually removed or taken out. Now, 30 years ago, it was common to take the whole meniscus out. Surgeons would open up the knee, take the whole piece of cartilage out, leaving behind just the bones with no cushion or no padding. Today, with arthroscopic techniques, we're able to take a small camera, put it in the knee joint, and trim the tear out and leave as much of the normal meniscus behind as we possibly can. There are some cases where the meniscus is torn in an area where there is good blood supply, particularly in the periphery or the rim of the meniscus. In those cases, we suture or stitch the meniscus back together. The success rate really for that depends on the age of the patient and the type of the tear. Certain tears are more amenable to being repaired than others, and that's what your surgeon has to determine to try to make the best decision. We really don't know any good prevention strategies for meniscus tears, but in general, strength and conditioning training that focuses on muscle balance, core balance, and proper technique is important with all these injuries to try to prevent the meniscus tears from occurring.
Thank you, Dr. Kane. A torn meniscus, I mean, that's something that can have an effect not only on their immediate career, but really an athlete's quality of life 10, 15, 20 years down the road.
No question. And the last thing we want is for a young person or young athlete to lose part of their meniscus. So we try to save it at all possible cost. And the only ones we take out are the ones that have tears that are not going to heal because they don't have good blood supply. I think it's important that when you have any kind of an injury, especially a meniscus tear, that you have proper evaluation, that you have proper treatment, and especially after surgery have the proper rehabilitation to get the muscle strength back, to get the core strength back so that you have good technique and good form, and that hopefully prevents you from having trouble down the road.
You know, one thing as an athletic trainer, you know, my goal with all of our athletes, you know, is to make sure that we take care of them in such a way that after their career is over, they're going to have a healthy life, and they're going to have good quality of life after they've played, you know, competitive athletics at a very, very high level, whether it's here or at the next level, you know, with professional sports. So it's so great to know that our athletes are in the hands of such great physicians like Dr. Kane and the entire group at the Andrews Sports Medicine Clinic. Dr. Kane, True, thanks for joining us. Hopefully one day you'll be on the sideline with us.
Thank you, Jeff. We at Andrews Sports Medicine are very proud to be part of the University of Alabama tradition, the medical staff, and part of the system at the University of Alabama. Our commitment every day is to provide the best possible treatment, therapy after treatment, and preventative education for all of these injuries. If you have any questions about a meniscus tear or any other injury, please visit our website at www.andrewscenters.com or call us at 205-939-3699.